we're here today because Anita had some questions to ask me and to share with you guys. And while we were doing that, what we figured we would do is I would teach her how to suture.
Yeah, I'm excited but a little nervous because I know how to sew clothes, but I don't know how to sew skin. So we'll see how different this is. I'm sure it's worlds different, but
well,
yeah.
You're probably going to be great at it if you've sewn clothes before. And so today we have some fake skin, thankfully. You're not going to have to do pig's feet.
Yes.
Normally, when we teach medical students in the hospital and stuff on the rotation, we do pig's feet. We decided to keep it clean and not smelly today, and to do just fake skin. So we ordered in some fake skin.
Yes.
Before I get out the fake skin, let me explain to you what we've done here. So normally, this is already set up for you, but normally what we would do is everything that's on this table comes in sterile conditions typically. So for example, these instruments here, they're needle drivers. They kind of have round, blunted tips, not sharp at all, and these are for holding the needle. They're pickups. And you know what you're going to do is once you drive a needle through, you're going to use this to pick up your needle, to guide it and take care of it. Awesome. And then the scissors, of course, small scissors for cutting our suture when we're done. These all come in sterile packaging like this. And normally what we do is we just open this sterilely and we break it out onto the table. Okay. That's what that is. Now these blue surgical protective barriers that we have here, towels or drapes, they also come in sterile packets. Same thing, you would open this and you would drop it out onto the table sterilely. Okay. And our gloves that we cheated and we put on right off the bat, it didn't have Anita's size because nobody her size does procedures here.
Right, so they're a little big today, but it's okay. I think we'll be just fine.
You'll make them work?
Yeah, exactly.
Those gloves also come in sterile packages, and we open these up and we break these onto the tray, and then there's a way that we put them on without putting any bacteria in our field.
Awesome.
Okay. Here we have our anesthetics. There are different types of anesthetic. The most commonly used are just like pure lidocaine. And this is one that has lidocaine with epinephrine. Oh. Yeah, the difference is that whenever you put epinephrine in with lidocaine, it typically lasts a little bit longer. So with this one, we might get, say, 2 hours worth of anesthetic effect around a wound. With this one, we might get another hour out of it. But the most important reason we use that with epinephrine in there is to stop bleeding. Okay. So when you go to sew up a wound, it's bleeding everywhere and you can't see. And someone either needs to be dabbing it constantly, or you need to help it by causing the vessels to constrict. Okay. So there's no bleeding. So that's when we use the one with epinephrine. And this, as you can see, it comes sterilely as well with a top like this. And we pop this off and then it's sterile so the needle can injure it. Needles are the same way. So just to give you an example of how we would typically open up a needle under our sterile field or any of these things, we grab by the peel here, we go like this. Notice it hasn't touched anything. It's still in its sterile package. And it would drop out onto the table like that. So that would be, and we would do that for every instrument, for every towel, for everything here. Wow. Okay. Last thing we've done, and then we'll be done with our prep here, is I have out some different types of suture here. I have out some fine suture. Today we're going to do some smaller wounds. So we have fine suture, meaning smaller size thread with smaller needles. Usually the smaller the needle, the smaller the thread, the more difficult it is to sew. So I'm going to have you use the 4-0. This is a bigger needle, and it's a bigger thread. And on some of them, I'm going to use a very small one. Okay. Now where we would use the different suture, for example, is the size of the wound or the location of the wound. Okay. So if I was going to sew a face, I'd want to use the very smallest thing that I had, like 6-0. Okay, awesome. This one is 5-0, so it's small, but it's a little bigger than this. And then obviously when you get to 4-0, you get to even bigger. Right. So the smaller the number, the bigger the thread. Okay. And typically the bigger the needle too. Yeah. So these are some that we're going to practice with today. So you have instruments, needle, anesthetic, and such. Awesome. Again, we're going to pretend today like we've opened these all up sterilely. We're going to pretend like we've put our gloves on sterilely. What do you think? Exactly.
I'm very excited. I'm a little nervous. We're going to be able to see this fake skin for the first time. Ooh. I'm sure it's not going to be like the pig skin that you are talking about, but you can kind of explain to us what's going on here. So
let's see.
Without further ado, let's get into it.
What did you guys get in here?
Oh my gosh.
Ooh, it's feeling a little gushy here.
That looks gelatinous.
Well, how do you... That's a good way to describe it.
Oh my gosh.
Oh my. This is
looks sticky, huh?
Ooh, okay. So here is our skin.
Wow.
Pretty neat. Want to feel
Oh my gosh. Yes, and we actually got one for you as well. Yeah, so
nice. I get my own skin.
Yes, you get your own skin.
We have enough wounds here for many episodes.
I know, we do. We might have to do another episode then, huh? Right. That's awesome.
So the first thing I noticed with this skin is it's not exactly like real skin would be. And the reason is that you can see they've made a laceration. They've shown kind of like some underlying tissue, this pink in here. There's kind of fat ones. There's curvy ones. We'll stick with some simple basics today because this is your first time.
Okay, yeah, let's do it.
And then there's a nice straight one. We'll actually probably start on the nice straight one that's close together because that's the easiest. But in filling this, it feels a little rubbery.
Yeah, it feels like silicone to me.
Yeah.
You know, gelatinous, like I was saying earlier.
It was a good description.
So
you can see they've made an attempt here to do kind of an epidermis, a subcuticular layer, a dermis. These are different layers of the skin as they go through. In reality, what's different here is usually once you get below the surface of the skin, once you get below the epidermis, it's a lot looser. There's like almost like a cavity there.
Okay.
And that's really important, and the texture changes a lot, and how you put your needle through that changes a lot. So this will be semi-realistic, but not exact today.
Yeah, not like the pig's feet.
Not like the pig's feet. That is very realistic. So
yeah, we'll give it a go then.
Okay, here's where we'll
Lead
start.
the way. Yeah.
Here's where we'll start. Now, do you remember how I showed you how to open something sterilely?
Yes.
Okay,
We'll pull it open.
Let's see if you pass your first step. You can open a 4-0 for you.
All right. So, fair warning, I am not in the medical field. I have no idea what I'm doing, but like I mentioned earlier, I have sewn before. So we'll see how these skills transfer over. I don't know if I'm qualified for this. I don't think I am, and that's okay. We've got a doctor here that is. I don't need to be qualified, but this is just for fun. So, please don't criticize my sewing skills too much.
Go ahead.
Okay?
Go ahead. Criticize.
Okay, so let's see. Let's see if I'm going to do it right. I'm a little nervous because I don't know what's coming out of the package. Okay. There we go.
Very nice.
Okay.
Now, we wouldn't do this in real life. We wouldn't hit gloves.
Yeah.
We'd also have gowns on.
Right. But for the sake of this video, I think I did a good job.
You did a great job.
Awesome.
So now what you'll do is, actually, let me open one. And what you'll do is you'll copy me.
Okay. Yeah. Sounds good.
So nice and wide apart.
Oh, wow.
Sterile like that. Then we grab our needle driver.
Okay. Here we go.
Now, you want to hold your needle driver, typically ring finger in here.
Okay.
Thumb in here.
Okay.
And then your finger here. Your finger's going to act as your guide.
Okay.
And then a lot of times when we're actually sewing, what you'll do, let's put your piece of skin
let's
here
get
for
me
a
all
second.
situated.
Yes. So what you'll do is you'll use your finger to kind of guide your needle through.
Okay.
As you guide your needle through, so it's kind of a lot of wrist.
Yeah.
Finger is a steady guide. Sometimes you can even put your finger on someone's skin to help steady yourself.
Okay.
But as you drive through, and again, we'll do this realistically in a minute here.
Yeah.
You'll drive through, and then you'll pick up with your pickups, and you'll pull it up, and you'll re-grab your needle.
Okay.
Okay. Here are your pickups.
Awesome. Thank you.
Okay. Needle driver, you have your 4-0.
Sounds good. Let's see.
Grab your suture kit here.
Okay.
Or your suture.
Woo.
Then needle driver in, pick up your needle.
Okay.
I like to pick up at about the back 1/3.
Okay, here we go.
Like this.
Am I holding it the wrong way?
You're holding it
is upside down.
It's upside down. Yep, that's okay.
Okay, do we want to try?
So
flip it over.
There you go. Perfect. And back 1/3, but not too close. Not too close to where the thread is there, or you'll break it. Okay. So just about there.
All right. I don't think I'm straight here.
Nice. Yep, not straight, but nice otherwise. You've already stuck yourself.
Good thing this isn't a real patient here.
That's
right. My goodness.
Then, if you'll notice, go ahead and pull it out.
All right.
Now, if you'll notice, see how the suture is all like crooked, like the packet it came out of?
Oh, yeah.
It's always that way. So what we like to do is we like to take it and just gently kind of hold up here with your fingers and down here.
Okay.
And just give it a little straightening. And see how that straightens out a little bit. Not perfect, but it gets a little bit straighter.
All
now,
right.
don't pull. What you don't do is you don't pull the string with your needle there.
Okay.
You get your fingers here.
So
Get your fingers here. You're pulling actually between your fingers.
Gotcha.
Because if
I'm not holding it
you'll
right,
be stressing it there.
Oh, yeah. Okay.
So we pull here, we get a nice straight line.
Gotcha.
And the reason is that when you drag that needle through, what you do is you drag all this suture through as well.
Wow.
And it goes through rough and sometimes almost in knots if you haven't straightened it out.
Yeah.
And the more tissue trauma you get, the worse your scar is.
Oh, gosh. Okay, so we want to be nice and gentle and go nice and straight with it, right? We want to,
That's correct. Now,
okay.
what I'm going to do is I'm going to do one suture on this wound here to show you something real quick. We're going to put our smaller sutures down here.
Clear our area here.
With suturing, it's simple in that, so we're working with two hands, okay? And remember that you're not like grabbing the instruments too hard, just gentle, right?
Okay.
And so I position my guiding finger, and then usually as you go in, you want to make sure that the whole premise is equal in, equal depth, equal out.
Right.
Now,
Right.
remember these needles are curved.
Okay.
So if we just go like this and we just bite in there, we're going to take a big old bite of tissue.
Oh my
I mean,
goodness.
it just really grabs. Because this needle is going deeper. Sorry, patient. It's going deeper than you realize, because it's going down and curving down deep inside there.
Right.
Like that. So what we want to do, we want to kind of gently grab our skin. We want to go in 90 degrees. So I'm putting about that much distance between the edge of the wound.
Yeah.
I'm picking it, if I go in this far from this edge of the wound, I'm going to come out this far from the edge of the wound.
Gotcha.
If I go in this far from the edge of the wound, I'm going to come out that far from the edge of the wound here.
Gotcha.
Okay?
Okay.
So, nice straight needle again.
Yeah. Ooh.
I like the back 1/3 just so I can get, so I can control the needle the entire time. I go in at about 90 degrees. I'm going to go in about that far from the edge. Get just through the base of the bottom of the wound. Equal depth. Back out. On this side, equal distance. Oops. Sorry, I'm in a weird position because I'm trying to show you.
Yeah.
Now, see, that would not be a very good suture. And,
no.
and the reason is, watch, I'll show you.
Let's see.
We'll pull this through. Our needle driver here. The reason that would not be good is, you see how this side is a little bit farther from there, or closer than there.
Yeah.
And the other thing, look at the angle it's at.
Right,
So
it's not-
this doesn't come across nice and square. What we want to do, we want to come across nice and square, meaning straight point to straight point, straight point to straight point. Now, in a minute, I'm going to show you a different type of suture called a running suture.
Okay.
So let's focus here for a second, because typically I wouldn't put my needle down.
Yeah.
When you get here, your instrument goes on the inside of your V. See this V?
Yeah.
Where I went in, I came out.
Okay.
We go around it twice.
All right.
Then we grab here,
Okay.
and then we pull across where, see this, hold on 1 second.
Okay, now we've made a double knot.
Can you see that plus? Like it almost formed like a perfect cross coming across.
Yeah.
Then when you're here, the way you remember this, you always get it right. Always stay on the inside of the V. So here I'm on the inside of the V. One twist around my instrument.
Okay, so we did 2 twists the first time, now 1 twist to secure it.
Yep. And then here inside of the V.
Oh, and a third.
And a back. And what I like to do at the end is I like to kind of pull my sutures over to one side. So at the end they make the wound look a little bit better.
Yeah.
And then what we'll do is we do a cut and a cut, and then we have a suture.
Okay.
Okay, so sorry, a little bit tough reaching across, but let me see you do one now, and I'm going to guide you through the process.
All right, let's see if I can successfully do my very first suture. So, okay, I'm going to start on this one back here.
Okay.
All right, see, I'm not ambidextrous. I didn't know this was a 2-hand procedure here. So, forgive me if I'm doing things the wrong way here.
Okay.
But I've got my positioning right?
Yep.
I've got my ring finger in the back loop, my thumb right here.
Yes.
We're trying to be nice and soft. We're on the back 3/4, right? Like we were talking about. Okay, so let's just go. Oh, we got to go a little more, huh?
Yeah, so what we want to do is we want to hit the skin at about 90.
Okay.
Control our depth.
All right.
Then rotate.
Okay, let's see.
And if in doubt, as you do that, remember that you can control your wound in real life. You can control your wound with your pickups.
Okay.
So if it's like, say it was moving around, or you can control it like that, then go in and then through. Like
Okay.
That. Okay.
All right. Let's go ahead. I'm going to grab the skin right here.
Okay.
We're going at a 90.
I'm gonna get down our light here a little closer for you.
Okay. Let's see. I feel like I'm holding this the wrong way. This is at the right distance, right?
It's decent. You're a little far back, but it's okay. That part won't affect your suture much.
Okay.
Yeah, it won't affect it much. Particularly, what I noticed when I put mine through just now is because this isn't identical to skin, the needle didn't come all the way through. And then we were having a hard time grabbing it. That's just because it's not exactly real skin.
Not real skin. Exactly. Okay, so fair warning, this isn't exactly the same. Okay, let's go ahead. Without further ado, let's just get right into it. I'm going to control the skin like you were talking about. Let's go to 90. Ooh, I am very shaky. I don't know how good of a a doctor, I would be here.
Well, in her defense, we are doing this in the morning, and all I've had is coffee as well, so I'm probably not
Yeah,
even
so, okay, here we go. And now I gotta pick it up, right?
Yes.
And pull it through. Now, I think my depth isn't 100% equal, if we're being honest. But for the first try, I think this is pretty good.
You took the words right out of my mouth. I was going to tell you both of those things.
Okay,
You were a little
awesome.
deeper on this side than on this side.
Yeah.
But your distance from the edge of the skin here, from here to here and here is excellent.
Oh.
So excellent
didn't know
distance,
that.
which will result in it looking well. Depth is a little off.
Yeah.
Now in real skin, if you get the depth off, what ends up happening is that sometimes the tissue will bunch up from underneath and it'll make your wound look worse, or it will heal worse if you're not perfect. Because the idea is you want it to basically just come together just perfect, just right together.
Yeah.
So if it's deeper on one side than the other, then what can happen is you can get kind of a layering effect like this instead of this.
Gotcha.
Because when you tighten it.
Yeah.
This one is pretty close, and again, this skin is pretty forgiving because it's kind of dense.
Yeah.
And so it'll probably come together nicely. Okay, let's see this. Let's see, sew it up.
All right, so if I remember right, we're right down here. We stay inside the V. We're gonna, oh goodness gracious.
So you're better on this one to just, for sake of learning it first, just to use your hand to grab it. Yeah, use your hand. There you go.
And we'll go over twice. 1, 2. And now we grabbed this one here, right?
Yep.
And we pulled it through.
Opposite way.
Oh, wrong way. Am I even doing it?
Yeah.
Okay.
Good. Now, great learning point here. So two things happen.
Yeah.
Look how much tail you left on your suture. Do you see this?
Yeah, that's a lot of tail right there.
So see how hard it was to get through? Do you notice when I did mine, and I didn't tell you that when I did it, but you notice how there's just a little tail?
Yeah.
It's so much easier on your knot tying because you're just right at the surface of the wound and you're just tying there. Now, what you're going to find is you're going to be every time up high kind of running all the way down. So go ahead and we'll see that now. But this is perfect. See how that laid down nice and smoothly like that? Now, if you do one the wrong direction, this will get all bunched up like this.
Gotcha. And
see how that does not look right?
Right, exactly.
Yeah, so you did it the right direction.
Awesome.
So we want the exact right amount of tension here where the skin doesn't bunch up, but it just approximates. And by approximate, just the laceration here just touches together.
Gotcha.
Touches together.
Right.
If it does this, it's wrong.
Yeah.
And if it doesn't do quite enough, it's wrong. So just touches together.
Okay.
And so that looks like a little bit firm.
A little firm, but hey, for the first try,
yeah,
right?
very good. I'm impressed. I'm impressed.
Okay, so we're gonna go this time. We've got one loop, and I'm gonna grab it. And am I pulling it this way or the other way?
You're pulling it this way, yes.
This way, okay.
Correct.
Oh,
see that big
see my
tail? Yeah, see how that's kind of messing with you?
Yeah.
And you'll be able to tell that you pulled it the right direction because it'll lay down a really neat, nice knot. Awesome. Okay, now do in the middle again.
All right.
Let's go. Nope. Yeah, you can do that. That's fine.
Okay. We've got this one, and I'm pulling this way, right?
That way.
Other way. Okay.
And you're always going to be going opposite.
My goodness, this is quite a task here. I'm not used to this, but I'm not sure. What do you think how do you think I do, Doc?
I better put on the glasses.
Right, let's see what's going on.
I better critique this one.
Right. For my first time, I'm not a med student here.
First time, I'm going to give her...
What do you think? It's okay, be honest.
B plus?
A B plus? You're being nice.
No,
that's probably a C right there.
No, this has potential.
You're being nice.
So
what Dr. Ramos means is this is a solid D. There we go. Solid D.
So let me show you kind of an easy way to do this. So when you get this through over here with a knot tying, because that seemed to be where the struggles were. First thing was you had a tail about like this.
Right.
Right? We want our tail to be right down here by our skin where we're working.
Right. Gotcha.
Then if you control all this suture here, you'll be able to do this really quick because you don't waste much space. See? So look, I lay down.
Very quick.
I lay down. I lay down.
Wow.
I lay down. And so I'm pulling everything opposite.
Oh, okay.
I don't know if you could tell that, but I pulled one direction, one the other direction, right?
Yeah.
And so let me cut that out and do that again and show you in slow motion.
I know you did a few steps there that I couldn't follow.
Yes. So we're going to do this in slow-mo now.
Okay.
So.
All right. Let's see what's going on here. Whew.
Okay, so we want room for our needle to get all the way through the skin.
Yeah.
We want a nice straight piece of suture that we're going to drag through. So we want a nice even entrance and exit. 90 in, across, same depth, 90 out and up, same distance.
Okay.
Okay, same distance, across, equal depth to width. See that?
Yeah.
Then, for starters, usually once you sew a lot, you can just sew from about any distance with the length of suture you have. But for now, to keep it simple, come down close to your suture on the inside. 1, 2, grab, and then watch towards me. This will be a good way. So I start on the inside of the V, and look how that's laying down. See that?
Wow, very nice. Yes.
See that? Then we pull down till it just touches together.
Gotcha. Wow.
Inside the V.
Yeah.
Around. Now away from me.
There we go.
Away from me.
See, I was getting confused with the directions that you pull with each knot.
And see if you kept your instrument there like this. Now watch. Without even moving, I'm going around my instrument. And now which direction am I going to go?
Towards you.
Towards me.
There we go.
Towards me, okay? Now look where my instrument is. Right in the middle.
Gotcha.
Now which way am I going to pull?
Away.
Away from me.
All right.
So towards, away, towards, away, towards, away. And then you can just get really super fast with doing that.
Yeah.
And you can haul some butt. Because if you can imagine, you have to sew up a bunch of wounds like this all night in a hospital.
Yeah.
How long it would take.
You got to get nice and fast with it, huh?
Yep. And there's a
Oh, my
suture.
goodness.
Okay.
Wow. Okay. And now, do I have a scissor? Let's try. And is this the only one here?
Yep. We're sharing that.
All right.
We're sharing that.
Okay. All right. Let's go ahead and maybe give it one more try and see how I do. Maybe one more critique. And then I'm going to start asking you some questions and put you in the hot seat. How about that?
I like it. Let's do
Okay.
it.
So I'm cheating a little bit. I'm going to grab it with my hands first.
Yeah,
Okay.
yep, I was cheating as well. Just for
This is
time's sake.
Right. This isn't a real patient here. It's
That's
not pigskin either. So, okay. I'm not in the right position. Now we are. Okay. Here we go. All right. Second time's a charm, right? We're going to 90 degree. Ooh,
Pretty good.
kind of.
Yep.
Okay. We are not going through the skin. Ooh, this one feels really rough. I'm not even paying attention to what's happening. That one looked pretty scary. Okay, so we are diagonal here.
That one's a little rough. That's yeah.
Let's pull it out. Yeah, let's back out a little bit. Okay, so let's try it again here. Right there. Now, this one felt still diagonal,
Not too bad though.
but
That's
we're
better.
for the first time, second time.
Second time. Yeah.
We're just trying it out here.
This
So
time you're gonna get the knots perfectly. I can tell.
all right, let's see. You've got some faith in me. I'm gonna do it with my hands this
Yep,
time.
that's fine.
Okay, we got one. Oh, these gloves are a little big. 1, 2, and we're gonna do
Towards
to the left.
There you go.
Okay.
Now look at it. See how it lays down.
Nice and pretty.
Perfect. And you see that? See how nice that laid down right there?
Wow.
Perfect. Your
Beautiful.
tension's good. It's just kind of against itself. It's not buckled up.
Right.
That's perfect. I like it.
Awesome. Okay, and then we're gonna go 1 and away from me.
And
The
see,
tail is still a little long.
yes, you
Notice
took
that.
the words out of my mouth. Pull it
Yeah.
down till it's tied to the other knot.
Now, this isn't the right position I would be in, right? Typically, make it a little easier on me, right?
So your instrument would have stayed inside, then you'll
Yeah.
grab and pull that way now.
All right, here we go. Now, I would say for someone doing this for the first time, I think I am doing all right.
Yes, you are. You're doing a great job.
Oh, my knot wasn't
Oh,
very tight
this
on the first one, I
yeah,
think.
first one the knot was a little loose, but that looks
Yeah.
really good. That's a really
Okay.
good one.
Interesting. Okay.
I like that.
I did better than I expected here. All
like
right.
it.
Awesome. Well, I'm going to let you suture on your own. I'm going to start playing with my scars over here and let's see, or my wounds, and let's see how I can do.
Okay.
But like I said, I'm going to put you in the hot seat.
Nice, you do it.
We're going to ask some questions that a lot of people typically ask Dr. Ramos, or, some things that people might want to know regarding law firms, or, all the good things, right?
Okay.
Okay, so without further ado, my first question is, why do personal injury attorneys get the bad rep of being an ambulance chaser?
Well, I think that probably the reason is, I'm going to do a little sewing here. I'm going to show you
Yeah.
another suture while we're doing this.
Yeah.
Probably the reason is that, unfortunately, everything that people need personal injury attorneys for typically involves injuries or ambulances. So it was kind of a thing that seemed to kind of go with the flow of what we do.
Right.
It was... when all of your people have severe injuries and they all are going in ambulances, then what happens is you become an ambulance chaser, because people at least said that, because that's how we made our living, was off of ambulances. Now, I think that that's a little unfair, and I obviously don't like the term, because the reason that people need personal injury attorneys after ambulances is typically because of the amount of bills and such they have. Massive amounts of medical bills. We see, it's not unusual to see medical bills of, hundreds of thousands of dollars. A single life flight, helicopter flight's about 30,000 or more.
Oh my goodness.
Yes, and a single ambulance ride, thousands and thousands of dollars depending on what they do. Yeah, so it's really expensive. So I think ambulance chaser, again, just, it'd be, I guess it would be like, if you call a guy that cuts down trees all day a wood chopper. If you call, if you talk to somebody who works with, sewing all day, a seamstress.
Yeah.
Well, we work with injuries all day and involves ambulances, so that's where the term came from, but it does have a negative connotation to it, unfortunately.
Yeah.
While we're talking about your next question you're about to ask me, I want to show you something. So I did a suture here, but notice I only cut one tail of it.
Yeah.
See that? I cut just one side. So this one here is an easy one. It's a running suture, and this is, you can do this to save time. What you can do is, it's still the same premise of distance. I'm going to do this quick, so this is not going to be neat, because I'm trying to show you more of the concept than the perfection nature of it. So what you do here is, you basically, when you go through, you come back over here without cutting the tail of it. Well, let me just do this quickly. I'm not doing this correctly, because I'd be doing this with my instruments. But then you keep suture out of the way. I still haven't cut anything. Back over. Same distance. Same distance. Same 90. And you still try to come out at across from each other.
Okay.
And then what you do is, watch this. You get the idea here.
Wow, look.
So this is running. Now watch, we'll do one more. Sorry, I'm doing this quick here. So I typically would grab this with my instrument, wouldn't touch it.
Right, exactly.
But for sake of showing here, same distance, 90, same distance, up. Now watch how this starts to look.
So this is starting to look a little more like hand sewing.
See
Something
that?
in my wheelhouse, right?
Yes. Now if you did somebody's wound this way, I'd be upset with you, because, well, I'll show you. Watch, I'll make another error here just to show you how to make a good error that we commonly see. Where a wound doesn't come out right. So look at this. You see how this one is a big bite? See how far this is?
Yeah.
This one's in close.
Right.
This one goes an angle over here.
Okay.
You see that?
Yeah.
So that's kind of, it's pulling it together nicely, but it's not well done.
Right.
When you see sutures like that, you're like, beginner.
Yeah.
Like an intern sewed them up or something.
Yeah. Oh my gosh.
Yeah. So ideally, when you do a running suture, you also want equidistance on your run. And then, see, so this one would be, well, it's so screwed up now I can't fix it, but you'd want it to be about the same distance away from the others. Right. Because you'll see how bad this looks once it gets farther down the line.
Oh, my, yeah.
See how once you get more, you start to see the differences.
Right. Exactly.
And it's coming together but at least you can see what I mean.
Yeah.
Yeah.
No, that's
a running suture.
I mean, you're bringing it together nicely, but it doesn't look nice.
Doesn't look nice.
Yeah.
And the other thing is that anytime you have sutures that are off like that, typically they've grabbed other tissues or other depths potentially, and then your healing won't be as good. So the surface might look good,
right?
But the underlying work, this kind of shows the surface, kind of shows what's underneath.
Oh my goodness.
Yeah.
Wow.
Sorry, what other questions did you have?
Oh, no, you're good. Well, my other question is, what are some challenges you find with personal injury law?
I would say one of the biggest challenges that we have, I mean, I look at that from two perspectives. One is, what's the biggest challenges we find with the people that we have to deal with on behalf of our injured people? The biggest challenges there are the insurance companies I think that there's a lot of insurance agents that mean well, but the bottom line is they're for-profit companies. And when you're a for-profit company, you're always going to look out for the best interest of the company and not the best interest of the injured person.
Wow.
And that's tough, because sometimes it'd be so easy if they just did what was right. And I always said they'd put us out of business if they did what was right.
Wow.
But they fight with people, and by they I'm talking about kind of insurance companies.
Yeah.
Or sometimes silly things. And those silly things are in an effort to save money, because they're a for-profit company. So our biggest problem outside of the firm is probably related to that, getting people the benefits and the help that they deserve and that they need. Wow. Now, the biggest thing that we deal with firm with our clients, the biggest problem we deal with is that there's a lot of commercials out there about, basically, have you been injured? I get you $1 million type of a thing.
Right.
And that's a big problem because I think a lot of people are under this perception that if you get in a wreck, you're going to get a check.
I mean, you hear it all the time, get in a wreck, get a check.
Yeah.
And so I'm now going back to the ambulance chaser conversation. It's just, now you're just creating a whole bad rep for every lawyer. It doesn't matter how good, right?
You're so right. You're exactly right. And that's where attorneys have earned that title of ambulance chaser with that approach.
Wow.
It's not really that. It's not that you get in a wreck and get a check. It's that when you get in a wreck, you get taken care of for your losses. And so nobody that gets into a wreck actually feels like they came out great. So there's this big misconception of the people that we take care of that they're going to be able to basically get in a wreck, get a check, and life's going to be good again. And it's not that way. They usually have got some sort of significant deficit that's happened, some sort of shortage. They lost wages. They're never really feel good about how it ends.
Wow.
And that kind of stinks. That's probably the hardest thing I have to deal with clients is just that perception of reality that attorneys have created versus how reality really is.
Wow. That's pretty unfortunate. And that kind of brings me to the thought of, what are some challenging things that you deal with clients specifically, not just with, say the insurance adjusters and insurance companies. Like, what are some things that other personal injury attorneys might encounter with their clients, and how do you overcome those challenges with the client themselves? Because we see all walks of life every single day, and I know you deal with a lot of different people. And so how would you deal with someone maybe in a challenging situation, or say a client's upset at you because their case is taking a while and they thought they would get their money instantly, get in a wreck, get a check. So how would you go about that? That was a little around the clock kind of thing. What's just explain it to me. How about that?
Yeah, that's a little. That's a. Let me answer what I think you're asking me.
Okay.
And then you ask me again if I don't get this all the way right.
Yeah.
And then I'll let you critique my suture here because I made all kinds of mistakes here so that you could critique this.
Okay. Oh, you went very fast. I only got 2 sutures in. But hey.
That's
anyways,
okay.
Yeah.
All right. So the first thing is that a lot of the clients need to be educated. It needs to be explained to them why what they thought isn't reality. So, for example, they may see a TV commercial that makes it sound really easy, like, hey, you got in this crash, you got hit, I got $100,000. Then they come in, they get in this crash, and they get hit, and then they're asked for all this information, and then they might even be asked sometimes for a statement, and then they might be asked about witnesses, and we might have to get film footage from an intersection, or then an insurance company might be inquiring about their medical records and their injury, and then they ask, the insurance may ask, hold on, that sounds very similar to what they had before, or the insurance may say something like, look, they're 65 years old, they got degenerative spine condition, this is their prior condition. It's not from the crash. They might have pain, but the pain is muscle pain, and muscle pain is not worth a lot. You're trying to claim it's spine pain, but that's all degenerative. That's old. They already had it. It's pre-existing, the condition. So on TV, they get the idea they got in a crash, they got $100,000. In our scenario, we get faced with all those questions before there's ever $100,000.
Wow.
And we have to answer those questions. We have to answer those questions right. We have to guide the person through it. So a lot of times it's just that education. It's just sitting there and explaining to them, look, the insurance company looked at your x-rays because they have doctors that they pay to look at these things. That's all they do is review records all day. And we say they looked at these records and you have degenerative changes, or you have shoulder pain now, but they found that 4 years ago, 5 years ago, you had shoulder pain then too.
Wow.
And the person say, well, that was from something different. That was just a little strain from throwing a baseball. And this is different. Well, the insurance company can't tell that. They see right shoulder pain as right shoulder pain. There's a lot to that. So typically just educating our clients and helping them to understand that what they see on TV is not the realities.
Yeah.
And there are many of those. I mean, there are many TV things that are not realities.
Wow. That's unfortunate. And you want to help your client as much as you can, right? But whenever you're not on the same page, it might be a little difficult. So that's where that explaining comes in, yeah. Yeah,
the communication is everything, and that's why in our law firm we encourage the attorneys to communicate regularly. Paralegals, legal assistants, communication. Because when people understand, they're very reasonable. When people don't understand, that's when they start to think you're either not doing your job or you're doing a poor job. And usually it's just a lack of communication.
Yeah. No, you see that in everyday life. I don't think that's
Yes.
just with one particular business. That's with anything, relationships, other businesses, all things. Communication does seem to be key.
Okay, before we go to your next question,
Yeah.
I need you to critique my suturing here because
Okay.
I did many things wrong.
All
Suturing
right.
across the table from my skin. Notice my skin is still perfect.
I know, your skin still looks
I
great.
jumped over and I'm suturing from a screwy angle on your stuff, and I started screwing up. So I just kept screwing up because I thought, well, you can critique me and learn.
Yeah.
Sometimes the best way to learn is by
looking.
critiquing somebody else's stuff. So what do you see here?
So first, obvious disclaimer: I am not qualified. Okay, but from the looks of it, let's take a look. And like we were discussing right over here, we've got the uneven depths. Right,
Yeah.
and it does not look equal. This one is more of an angle than these other two.
Perfect.
Over here we've got a shorter length of stitch and a longer one.
Yes,
and then
look
it
at
kind
that.
of it varies throughout. Right, these two actually look pretty similar. If these two were the same throughout the whole, the whole stitch, the suturing situation, I think this would be these two would be great. I don't know, maybe not, but yeah, and then these two are not at an angle. They're definitely more straight than the other ones. And then we've got a really tight stitch right here.
Yes, I was wondering if you'd catch that.
That looks like it would hurt, or while it's healing, maybe it would strain a little bit on the healing. Say they make a wrong movement, that looks a little scary to me. I wouldn't want to have that stitch, right?
Yeah,
So-
and you can see what happens when you put too much tension. Look at all this bunching up.
Wow.
See, and if this was
Yeah.
real skin, this would really be like really puckered. But here close up, we can see that this is really bunched up.
Oh my
The other thing you'll notice on this one, one other comment I want you to make is, in addition to it being way too tight and bunching up the tissue, you see, look how close to the margin I am here.
Oh my gosh, so we're very close right here, and this is what we're discussing, right?
Yes, how
wow.
far off the edge of the wound I am. So here's the wound. Look at this.
Oh,
It's
that's very-
barely off of it, right? So that's a suture that could actually pull through and then allow the wound to open back up.
See, that looks scary for healing. And like I was saying, making the wrong move while you're healing, so you kneel down and it stretches it out, that looks a little scary to me. I wouldn't want to have that suture in my body, right?
That's right.
Oh my gosh. Other than that, you did a fast job. Like I said, I only made it so far.
Let's look at your two sutures here.
Yeah, my two sutures are a little bit scary.
Uh-oh.
As you can see, they are just a worlds of a mess. I think my very first one was the best one right here, and this is just horrible.
The running ones need a little work. Yes, this was an outstanding suture over here. It's right depth, right tension, good knot, good ends.
Wow,
Here you can see you took a really big bite, and then you took a little bitty small bite. Different distance out from the skin, different out from the skin. Now you've already started out farther out than this one, right?
Yeah.
So your next one's really going to then be a problem. And that's the problem. The problem with running sutures is that once you get off, it's one mistake leads to the next mistake.
Oh yeah. Oh yeah.
Definitely.
Wow.
I want to show you a really neat suture while you're asking me the next question.
Yeah,
This
of
one we're going to
course.
use like we're suturing a facial wound. We're going to use your skin now. We're
Yeah.
saving this for episode 2.
We might as well, right? Feel free to position it in the way that you need positioned to efficiently do your job. Because here, I know we're at weird angles, right?
I'm going to do it here because I'm going to leave it where you can do the next one I'm going to do.
Okay.
So this is 6-0. This is the stuff that we would use for a face.
Okay, yeah.
So very small suture.
Wow.
Very small needle.
Yeah.
So let's get some of our
Tightening
curves
it.
there. Yeah. Just pull out some of those curves out. It's a
Wow.
lot straighter.
Yeah.
Now, I actually really like suturing with small suture on faces.
Yeah.
Because you can really get a nice job done with this. So think real finesse, real gentle as you're doing this. We're going to sew up. This is like, let's just pretend that this is a little cut in between somebody's eyebrows. This one
Right.
here. Now, in all honesty, when they're wide and gaping like this, we would probably put in deeper sutures.
Yeah.
I'm not going to put in deeper sutures today because I didn't bring any. But then you actually start inside the wound like this.
Oh, wow.
And you come up from the inside
Oh my
like
gosh.
this. And then you go back down.
Oh, wow.
Actually, we're not supposed to do it with a suture, but pretend this is absorbable suture.
Yeah.
Then we go, see where this one went in?
Yeah. Mm-hmm.
See on inside the wound?
Yeah.
Back through.
Wow. And you have to be really careful not to poke the patient here again, right?
Very careful. Yeah.
Oh my gosh.
And then we grab, pull it through. Now watch this.
Okay.
Watch how cool this is.
I'm going to bring it together.
Hold on here. I got a big old mess going. Watch how cool this is.
Here we go.
Now remember, look what that looks like now.
Wow.
Now watch it.
Okay.
You might be able to see it when I'll close this up, and then we'll see if we can see it with the camera. See, the suture's not meant for doing this. It wants to move. So I'm going to lock it. That's a whole other thing we're not going to go into today.
Yeah. Maybe another episode, right?
Another day, how to lock deep sutures.
Yeah.
So what happens is Proline is really slick and it's wanting to slide.
Yeah.
We use Vicryl, or they use cat gut for this, actually.
Oh my gosh.
Yes,
cat gut.
Darn it, this one is not wanting to go in there because it's not meant to do this. But anyway,
Yeah.
you get the idea here. Now watch this. Let's see if we can hold this up for Gabe to see.
Okay,
Now,
let me cut off this one right here. We've got a needle, and we'll just... There we go. We'll redo this.
yeah, show
All
them.
right,
what
Gabe.
we're
So
playing
let's see if we can take a look at this right over here. We kind of closed up the inside of this wound, but if Dr. Ramos wants to explain a little more of what's going on.
This one's a good example here, because what you see here is you see one that's not closed, big pink gap down in there, in that tissue. And here you see when it's enclosed. Just start to take the tension off of this.
Wow.
Now we did it with a suture you don't do it with, and so this suture is really slick, so it doesn't hold the inside together as good. But the reason you do that is this: when you put in a deep suture like we did there, again, I probably should have just had some deep absorbable suture out there to do it with. But what you do is you make it where now when we do the outside, there's no tension on this.
Oh wow!
Oh, let me grab on this here. See if I can grab.
Wow, so when you close it up, it's nice and tight and not gaping like maybe...
Yes, because under tension, you hit right on the head. The underlying tension is off of the wound.
Wow.
So you got our tail nice and small. Now watch how good the face wounds look with a little suture comes together.
Wow. This looks awesome.
This one you have to be really gentle with. Like really super gentle. And this is where that little tail I told you about is really important.
Yeah.
Even in, even out. Grab with our pickups.
Wow. Awesome.
1, 2. And then towards me.
Wow.
A little bit tight. And you can actually do, see what I'm doing right now?
Yeah,
you can
just
actually
spread
do that with real skin. You can actually
wow.
loosen up just a little bit. So I want it about that tight.
Wow.
Then away from me. Then to me.
Wow.
And then away from me. And watch this. Now, oh gosh, this skin, see how it's slipping?
Oh yeah, no, this is not normal skin. We'll put a disclaimer on this. You know, this skin is a little
I
difficult.
don't like that again.
Yeah, at least we get practice. But I'm sure real skin is easier than this.
So actually, and if you were really sewing something up and this kept happening, the reason it's happening is because there's so much tension down below in this wound, because this wound is open, that the underneath is pulling it apart. It's pulling it apart. And that's why you really need deep sutures in this one. So what I would do if I was really working on someone right now and I had really deep suture, like the good part that I was actually using, like the proper suture, I would put in more deeps.
Oh, wow,
Right
yeah.
down in there. Yeah, without a doubt. Now, the other thing you can do on a wound like this is you can start in the middle. See, we're starting at the end.
Oh, yeah.
And see, I'm going to take a big old bite this time because I know that this one's pulling apart.
Yeah.
So I'm going to take a big old bite in the middle.
Wow.
And what you can do sometimes is you can put it together like this, and then you can come back and cut that one out.
Okay.
Mm-hmm.
That makes it a little more convenient, it seems like. Let it hold it together.
But look how tough that skin is. So see, watch this,
Wow.
watch this. Okay, pulled it together. Perfect knot, right?
Right.
Now watch.
Wow. Pulls
See it pull
right
back
open.
apart?
Yep.
So this is going to be impossible to suture without putting deep suture in,
Wow.
good deep suture, and that was a perfect example. There's in the middle, big bite, nice square knot, pulled perfectly together, let go,
It just opens right up.
opens right up. So
Wow.
we're going to have to get deep suture to teach that lesson.
Yeah. We'll do that another time. How about that? So this one, this one looks real deep and interesting. So we would
Yes.
truly need some deep sutures for this one.
Well, and that,
wow.
let's do, let me show you with yours. This is
Yeah.
not, so deep suture, remember this, deep suture is absorbable.
Yeah.
So that's why they make it out of like cat gut.
Yeah.
This is a good one to show on because we can see our whole wound, and we start at the base of the wound and we come up and we get tissue, but we don't get the surface of the skin. So I don't know if you saw this, but look we didn't see, we're still in the wound. See that?
Yeah. Oh, wow.
Now watch. So you're sewing backwards. Oh, here's a little trick too. I forgot to tell you this. So I sewed backwards like this. What I do, what you teach at first, is you take the tail and go straight across.
Yeah.
That's where you go back in at.
Okay. So you can keep it nice and straight.
Yeah, and notice I didn't get the surface.
Yeah.
See how the surface is up there?
Okay.
See that?
Yeah.
I'm inside.
So we did not grab that surface.
And that one needs a little bit bigger bite. Like that.
Yeah.
Now I'm not going to tie this, but I'm going to show you how it would look.
Yeah.
And the reason I'm not tying it is it'll just slip.
Yeah.
And the reason is that one of the things about absorbable sutures is that it's rough, and so it holds down in there. This is silk, and this is very, very like slippery, right?
Yeah.
So watch this when I pull this together.
Wow.
Do you see that?
Yeah.
Now it slips, but
Oh goodness. Yeah.
so what I would do is I would go like this. I'm not going to finish it. I'm just going to show you. I'd go 1, 2, 1, 2, grab.
Wow. So even with it slipping, we are still seeing it come nice and tight together. But like you were saying, we would need specific.
Yes, and notice the minute I let go of it, look at the minute I let go of it, it kind of stays together a little, but not as good as absorbable would.
Yeah.
Absorbable would be like, it would go, and it would just stick it there. And then you do one there, one there, one there, one there, one there, one there, all the way up, just like we did on these other wounds.
Right.
And then what you'd have is you'd have the gap pulled together down inside, so that, which is what you have to do on the deep one. Because if I just came to this one, let me see if I can get this apart without cutting it. I might have to cut this. If we did this one, I'm trying to save our suture here.
Oh yeah.
If we did this one without,
there we go.
Perfect. So let's pull this through. So if we just did this and we sutured up top here, and let's just start in the middle just because we're just showing an example here.
Right.
And we went in and we went over and we went equal depth, equal distance, and then we see how that suture stretching across there?
Yeah.
And watch this, pulling this together.
It just stays nice and loose. That's why you need the deep ones, huh?
See that?
Wow.
Pops right back apart. Goes together perfectly right about there. Be where we want it.
And pops right open.
Yeah.
Wow.
Deep sutures only.
Yeah. Huh. Interesting. Wow.
Sorry, I interrupted your question.
No, you're fine. So despite all of the challenges that you see in your day-to-day work, what inspires you to continue to, practice personal injury law and continue to stay a medical doctor?
Well, with personal injury law, the thing that inspires me is that we really are helping people without asking them to pay us until we get them a result.
Wow.
And I really like that. I like helping anybody and everybody without question or regard. Just do it our very best by them. And we get paid at the end. We don't have people come to us and have to put out money to get representation. The other thing is that anybody that's been involved in a personal injury incident realizes is it's complicated. You get calls. They want recorded statements. You don't understand insurance. What's 25/50 mean, or 50/100? What do they mean I don't have UM or UIM? I thought I had full coverage. What do you mean my property damage is different from my bodily injury? What is med pay? And so there's all these different things, and we help people through every one of those steps. So I get a lot of gratification out of helping people without payment up front through a time of their life that's tough because they're having pain, they're having problems going to work, and we're there for them. We're there to say, hey, listen, we'll take the weight off of you so you can, heal and be the best you. I really like that. That's highly gratifying to me. What makes it more gratifying is what you went into. Then you added the medical aspect of, being a medical doctor. I'm a licensed medical doctor. I still practice a day a week, and I love medicine. And what law and medicine allows me to do is, in law, I'm actually dealing with medical issues just from a legal perspective. But I understand the medical issue. So law actually helps my medical career be even more gratifying. It makes it really full. And the other way around as well, in law, it makes me better medically because I see either medical mistakes or I see what people are going through. And as a medical doctor, I start and go, wow, I get the other side of this. When they're saying to me, I've heard clients say that in these crashes, the doctors and the attorneys get all the money. I didn't get that until I became a lawyer, and I looked at it and I was like, wow, if you don't deal with an honest lawyer, it can work out that way very easily, where the doctors and the attorneys get all the money. And now I get that. So it's made me a better medical doctor, and it's made me a better attorney, and the two go together hand in hand.
Wow. Okay, so I have a little fun question for you.
Okay.
If you were only able to do one thing for the rest of your life, being a medical doctor or being an attorney, which one would it be?
Whoa, I don't know if that's fun. That's serious.
Yeah.
That's tough. Well,
Yep.
It's actually not tough, because here's the thing. What I am for the rest of my life, without a doubt, is I'm a caretaker. Doctors are caretakers, but I now have learned that attorneys are caretakers too. So what I have to do is something that's helping take care of people. I get a lot of joy out of that. So the answer is that I would probably do either one of them and be extremely happy. My first love was medicine. My very first love was medicine, because that is taking care of anybody and everybody and doing your very best by them, and I get a lot of gratification from that. So my first love was medicine. My second love was law. Both involve caretaking, and if I could do either, I'd be totally happy.
Wow, that's awesome. So now I know you said that wasn't a fun question.
That wasn't a fun one. That wasn't fun.
But here's the real fun question. This could have been an icebreaker, but we're going to do an end of the episode icebreaker, right?
Okay.
So if you were to only eat one food for the rest of your life, well, obviously this food goes with other foods, would you have pasta for the rest of your life or rice?
Whoa, this is a fun one.
You can only have either or.
Don't even need to think about it. Pasta, no doubt.
Really?
Oh, I love pasta.
Oh my
yes.
God. What's your favorite pasta?
My favorite one? Probably fettuccine Alfredo. Yeah, I know it's heavy and I know it's thick, but gosh, it's good.
It's good.
Yes,
it is good.
I love fettuccine Alfredo.
Oh my gosh. Recently I've been getting into a lasagna kick. So I do love fettuccine Alfredo, but lasagna it's got my heart right now.
It does. Well, recently I have been trying the lighter pastas because I gained a bunch of weight, put on about 8 or 10 pounds, so I was like, okay, I still love pasta.
Yeah.
But I got to think of some way to cut it back a little.
Right.
So I've been trying some of the lighter stuff with not as much sauces and such. It's really good. Angel hair type stuff with very light, if any, flavoring. Super good.
Yeah. Okay. Well, good to know. That's awesome. I would personally do rice, I think.
Oh, you would?
I think I would. I grew up on rice.
White or brown?
White.
Oh, white.
Yeah, basmati. Basmati rice.
Okay.
But yeah, awesome. So I've got to know, if you had to rate my sutures from, an A to an F, what would you give me? I know I didn't do many of them, right? We have a couple right here, and we've got a few right there that I did not finish off. But what would you say?
Okay, so we went from a B plus, good distance, well approximated edge, not too much tension, B plus, to
It's okay.
this might be F work.
Really?
On this side, there's a little fragment of suture down in here, or a double loop. I can't even tell what this is below the skin. The tail here is just, it's hanging over into the other wound. You didn't even tie the knot to finish it off.
I left it.
You didn't even tie a knot to end the repair.
Yeah.
The distance is really off. Again, this fragment down here, I just can't get over. So we're going to average your B plus. Sorry, with your F, and I think you're going to get a C.
A C.
C.
Okay. C's are passing, right?
C's are passing. By episode 2 or 3 of this, though, I expect you to be able to take this big one and just close it up. Although I have to tell you, we might have to get a pig's foot to teach on, because look at this. Feel that. I mean,
it does bounce back.
I don't know that we can ever get this
closed.
fake skin we have here closed up on some of these. So
I might be open to trying that.
but it smells a little bit worse.
A little bit like what, formaldehyde? What? But
yeah, depending on which pig's feet we get, yes.
Yeah. Awesome. Well, I'll take my C and I'll run with it, and we'll see what I can do next time. But I know that you wanted to show us one more thing.
Yes.
So
I want you to take out a suture.
Okay, let's see. Tell me how to do it.
What happens with sutures is when they've been in for a while, and again, we keep in mind just a model.
Yeah.
But they get crusty. The skin comes together. It tries to grow actually over the suture a little bit, and they get somewhat buried.
Yeah.
And I literally have had people come into the emergency department who tried to dig out their own sutures and cut them out. By the time they were done, they practically had the wound back open again.
Oh, gosh.
Okay, so I'm going to show you a really simple technique for taking out sutures. The first thing is, rather than using scissors, which even with a fine point, you can do it.
Yeah.
And these are the grade of scissors I use, and the fine grade is still somewhat tough. What I suggest to people is just a fine razor blade.
Oh.
Okay,
Ooh.
so you get a little razor blade, and then it's really simple. You grab a tag, 'cause there's always a tag sticking up out of the wound. Always you can find a tag.
Okay.
No matter how grown in it is or what.
Yeah.
And you put just a little pressure to the side. And when you put that pressure to the side, again, imagine for a minute that this is healed.
Right.
You'll see the knot.
Yeah.
It'll kind of lift up because that's where the tag goes to. And if you touch right at the base of the knot,
Oh, pops right open.
pops right out.
Wow.
And it's just a touch. You probably can't tell this from the video, but literally when I'm doing this, it's just a touch. Like right here. And this is big, heavy suture. Oops. Lost it with my pickups. It's just, I keep losing my pickups here before I'm grabbing it. I'll grab the knot. Just a touch.
Wow.
So you can't really tell that, but I'm just touching it.
Yeah.
Just barely touching it. And then it's just releasing it to come through. So
Yeah.
let's see,
Wow.
let's try this one. So grab by a tag, pull the side, touch at the base of the knot. Oops.
Wow.
And out it comes.
That looks so
You just
easy.
touch it. Yeah, it really is. It's a lot easier than probably the film is doing justice to or what I'm doing. But once you have that tension, so if you ever have a suture take out at home, just grab the tag, pull to the side, find the knot, touch at the base of the knot, boom, and it'll pop just like that, and you can pull it right out.
Right. We always recommend going to a medical professional, but if you need to, right?
Yes, that's right.
Yeah.
That's right.
Okay, well that looks easy enough, but I don't know if I'd be that good at it. Honestly, after seeing my C grade on these sutures, but like you were saying, hopefully by episode 2, 3, 4, we'll see. Hopefully my grade has.
We'll see how you do
improved.
we'll see how you do with the scalpel. Now, if I give you this to cut out a knot and you cut into the skin, that is kicked out of medical school. Done.
Wow.
Yeah, no, I'm just kidding. I kicked out of medical school, but
I'm
that's
kicked out of
definite
the
F. Yeah, I definitely
right.
kicked out of lessons with me.
Yeah, I'm kicked out of the medical school I was never in.
That's
right?
Yes.
Awesome. Well, thank you so much for joining us and letting us be here in your office. We had an absolute blast, and like I was saying, hopefully next time I have a little better suturing skills. But
That was a lot of fun, and you did really good. The way you started off over here, I was like, whoa, you're making this look easy.
Wow.
Yeah.
Okay. That's awesome. I don't know if I'll be going to medical school, but you're the doctor. You're the in-house doctor, so that's all that matters, right?
Thanks. I had a lot of fun doing this with you.
Awesome. So did we. All right. Till next time, everyone. Have a good one.
Quick disclaimer, never do this at home. We are showing you how to suture wounds, how to remove sutures, but I am a medical professional teaching someone, and that doesn't mean that with a single lesson or watching this video that you can do this at home. And in fact, if you get a wound infection or you do it wrong, often it becomes much more difficult to repair. And then you get a lot of scarring, a lot of complications. It can get very serious. You can develop cellulitis or abscesses or many other things. So I strongly encourage you, if you ever have a wound, to go in and see a medical professional. Don't try to do it at home. This is just done today with Anita so that we could show you guys some of the thinking that goes in, and also how someone does with it who's never done it before. And I hope that you never have to do this or have it done to you, but hopefully this has been helpful.